Are you ready to return to running? Because if you had an ACL surgery, it's likely been a minute since you've done anything more than a fast walk. But before you get ahead of yourself, you need to make sure your body is ready and has the capacity to tolerate the demands of running. Because your body doesn't magically just get into shape, unfortunately. Up until this point, you should have been focused on regaining knee mobility and improving strength of your legs in preparation for the go-ahead to run. But don't let the verbal clearance from your surgeon fool you. If you fail these tests, you are not ready to run. I don't care what anybody says. And you may need to delay returning until you are in better condition, or run the risk of injury or setbacks. So in this video, I'll provide you with the key criteria to look out for when assessing your readiness, so you can hit the ground running instead of stumbling out of the gate. But not only that, I will also provide you with exercise suggestions to address any weaknesses you may have. Hey everybody, welcome back for another episode of Physio Show. Returning to running after an ACL surgery is an exciting phase of rehab. It represents a significant milestone in your progress, indicating that you are much closer to getting back into sports or engaging in recreational activities, whatever they may be. However, the path to returning to running should never be dictated solely based on the time since surgery. While time is a factor, it should not be the only consideration that determines your readiness to run. Unfortunately, time since surgery is very often the criteria used to clear people to run, which is extremely flawed. While yes, this may indicate sufficient healing of the ACL to tolerate such forces, it ignores literally everything else going on around the knee that is equally as important to success with running. It's critical that you regain sufficient muscle strength, balance, and basic coordination to run. But how do you know if you're ready? Well, there are some quick and simple assessments that can be performed to determine readiness to run. And you will notice that many of these tests can also be forms of exercise. So just like in school, you can practice to the test, which can help you with your performance. Now it's important to note that these assessments are typically performed 10 to 12 weeks after surgery, and should be performed under the supervision of your physical therapist. But they will provide you with good insight into your readiness to return to run, and what you may need to continue to work on. Let's start out with your range of motion. Your knee's ability to flex and extend fully is required to return to run. If you don't have the mobility, you won't be able to run. It's simple as that. That's why it's key to get flexibility back as soon as possible, and to continue to work on it throughout rehab as needed. Before you run, you should have equal range of motion to the uninjured side. A good way to test your knee's ability to extend is to sit and prop your heels up on the edge of a surface, and try to straighten your knees by contracting your quadriceps muscles to force your knees into extension. Most people will have some degree of hyperextension, which is perfectly normal. The goal is to have equal mobility to the other leg without any sensation of stiffness. If you feel this is stiff, you can turn this into an exercise by straightening out your legs until you feel a good stretch in your knee. For flexion, lay on your back and bend your knees as far back as possible. Both of your calves should be able to touch the back of your thighs without any notable stiffness. If your surgical knee does not move like your other knee, make sure you keep working on flexibility. You can go right into an exercise to improve knee flexion by slowly dropping your feet down to the floor while holding onto your shins. Perform these exercises a couple times a day to improve your flexibility. The next handful of tests are to assess muscular performance and should be compared to the non-surgical leg as well. At this stage, your surgical leg should score about 85% of the other leg for each test. Yes, there's a bit of math involved, so get those calculators out. This next test will assess the coordination and control of the muscles of the knee and hip when standing on one leg. After all, running is a bunch of single leg hops strung together. If you don't have single leg control, running is likely out of the question. To perform the single leg squat test, place your hands on your hips and perform 5 single leg squats to 60 degrees of knee flexion off the side of a step or a box. Go slow and focus on your control. If you can do this with your back, hips, and knees staying aligned, you pass. If your body is going every which way, or you can't go to sufficient depth, you need to keep working on it. Your knees should stay in line with your toes and not deviate inward or outward. Your hips should stay level and not dip. Again, it should look like a smooth, controlled motion without notable deviations. If you have issues with this test, turn this right into an exercise and focus on improving single leg control. Another key aspect of returning to running is to make sure you have really good strength of the muscles in the hips, specifically the glutes and hamstrings. This next test will assess how strong these muscles are compared to the other leg. For this test, you need something that can support your weight that is roughly 23 inches in height. To perform this test, place one heel on the surface in a slightly bent position. The other leg is bent to 90 degrees and is kept elevated. With your arms crossed over your chest, lift your hips up as high as possible, and repeat this motion as many times as you can. The test is stopped once you are unable to maintain the height that you achieved during the first repetition. Perform again on the other side. If you struggle with this test, you should focus on hamstring and glute strengthening exercises. A passing score is at least 85% of the other side, and being able to perform at least 20 repetitions on each side. Now, your glutes and hamstrings are not the only muscles that help propel your body forward while running. Your calves also assist in this motion, so it's important they are well conditioned. To perform this test, stand on one foot at the edge of a step and lift your heel all the way up. Perform as many repetitions as possible, making sure to reach the same height as you did on the first repetition. Once you start to lose the height, or you start to slow down, the test is ended. Make sure you are not pushing through your arms with this test. If you are having difficulty with this test, you should focus on calf strengthening exercises. A passing score is at least 85% of the other side, and being able to perform at least 20 repetitions. Now, if you're finding this video valuable, give it a like so it can continue to spread to more people like you who are looking for guidance on how to return to running after ACL surgery. I would really appreciate the help in growing the channel. The muscles along the side of your core and hips are important in controlling how your knee moves with running. Weakness in these areas can result in altered running mechanics and increased strain through your knee. To assess the performance of these muscles, begin by lying on your side with your legs straight. Place the top foot in front of the lower foot and then lift your hips up off the mat. Make sure to keep your hips and body from rotating and maintain a straight line from your head to your feet. Hold this position as long as possible. The test ends when you start to lose alignment or your hip starts to dip and touch the surface. If you have challenges with this test, time should be spent on glute medius and minimus strengthening, also known as your hip abductors, as well as core strength. A passing score is at least 85% of the other side and being able to hold the position for at least 30 seconds. Strength and endurance of the quadriceps muscle is essential to restore after ACL surgery. Due to the nature of the surgery, quadriceps weakness is very common and should be the primary focus of rehab. Weakness in this area will result in reduced knee control and power. To test quadriceps muscle strength, sit on a surface that allows you to bend your knees to 90 degrees. If you're taller and the surface is too low, try to elevate it with a couple of books or weights. Shift forward slightly so the back of your knee is 4 inches from the surface. With your arms crossed and your other leg extended, stand up from the surface and sit down as many times as possible. The knee should remain in line with your toes throughout the movement. Avoid your knee caving in or outward during the motion. Those types of reps don't count. Also, make sure you're not plopping. You should be able to lower yourself slowly and with control. If this test is difficult, greater focus should be placed on quadriceps strength and endurance. A passing score is at least 85% of the other side and being able to perform at least 10 repetitions with good form. Balance is another hallmark criteria of readiness to return to run. After ACL surgery, your sense of balance will be altered and will require proper training to restore. To assess your balance, stand on one leg with the other leg raised off the ground without touching the ground or the stance leg. Cross your arms over your chest and time how long this stance can be maintained. The time stops if you uncross your arms, the other foot either touches the ground or the stance leg, or if the stance foot comes off the ground at any point. A passing score is at least 45 seconds with your eyes open. The test is then repeated with your eyes closed with the same criteria. If this test is a challenge, focus on exercises to improve single leg balance control with your eyes opened and closed. A passing score with the eyes closed is holding the stance position for at least 10 seconds. For those looking to get back to high-level activities that require explosive power and quick changes of direction, simply being able to move your body weight is not enough. Significantly more strength will be necessary to safely and effectively return to more intensive activities. An excellent way to measure and track the strength of the lower leg is by utilizing a leg press machine to find your 1 rep maximum, meaning finding the heaviest weight you can move for 1 repetition. Because this is an intensive strength assessment, make sure to adequately warm up prior and perform a couple repetitions of lower weight before going straight into finding your 1 rep maximum. To perform this test, set up the seat so your hips and knees are at 90 degrees. Push through the surface with both legs to get to the starting position. Lift the leg not being tested off the surface and then slowly lower yourself so your knees and hips get to about 90 degrees and then return to the starting position. This test is performed until you find the maximum weight that you can perform for 1 repetition with good form. Notice that I started light and then slowly built up to find my 1 rep max. If you struggle with this test, continue to focus on hip and quadriceps strength training. The passing criteria for this test is if you can perform weight that is greater than or equal to 1.5 times your body weight, which includes the weight of the sled. ACL surgery has come a long way, and there is a fascinating procedure that is being performed that actually allows the ACL to heal on its own, which could be game-changing. Check out this video to learn more.